Hello, everyone, and welcome. I'm Alice Cameron, the Executive Director of HIV Services, and I'm so grateful for everyone for joining us today for this important discussion on HIV care, prevention, and the push to end the HIV epidemic in our state, the state of Illinois. Today is World AIDS Day, observed each year on December 1st. It's an opportunity for people to unite in the ongoing fight against HIV, show their support for people living with HIV, and remember those who have died from an HIV related illness. We have an incredible lineup of experts from Cook County Health, the Cook County Department of Public Health, and the AIDS Foundation of Chicago to discuss where we are in the fight against AIDS. Before we get started, with our questions, I would like the panel to briefly introduce themselves and describe the work you are currently doing in relation to HIV care, prevention, and advocacy. Dr. Monica Merson, would you like to go first?
Hi, good morning, everybody. I'm so happy to be here with you guys today, talking live about HIV and AIDS Day. So much different from where we have been 20 something years ago, 30 years ago, when I first started treating people living with HIV 26 years ago. Things were much different. We are happy that we have made so large strides in progress to eliminate HIV, to have people living with HIV living a normal, productive life, and having families and being happy as they should. So I think that is the best thing that we have to do right now to get to zero. So I am the medical director of the core center, and I'm an infectious disease provider and been working with HIV for that long. I've seen a lot, so I hope you can answer some questions today. Thank you.
Awesome. Thank you, Dr. Merson. And next we have Simone Collinger.
Thank you, Alice, Dr. Cameron, and all the co-panelists. It's so great to see you all and to the audience out there. My name is Simone Kollinger. I use she, her pronouns, and I'm the Chief Program Officer at the AIDS Foundation Chicago. And, we're so proud to be in partnership with so many organizations like the Cook County Health System, Cook County Department of Public Health, and the Core Center, among others. And we've been around for since the beginning, like you all. And thankfully, as Dr. McCone mentioned, the fight is much different today than it was over 40 years ago. The AIDS Foundation Chicago, we do many activities, but our core activities tend to focus around case management, housing, and policy and advocacy. In the case management space, we lead a large collaborative of amazing case managers who help people navigate our healthcare systems. In fact, we're so proud of the fact that in our Ryan White system, 90% of the clients are virally suppressed, which is a tremendous success. In housing, we also partner with a number of really great community organizations to make sure that folks have safe and stable homes so they can focus on their health and well-being. And then we have a really fantastic policy and advocacy team that amplifies the voice of the HIV/AIDS community. And they do that in Springfield, here in the state. They do that in Washington, D.C., and they do that in Chicago. And we make sure that everyone is heard and everyone is aware, and we keep fighting for adequate resources and to create stigma. So I'll leave it there. I know we'll talk more about services later, but thanks for having me.
Absolutely. Thank you, Simone. And next we have Toby Valicia Johnson.
Hi, I'm Toby. I am the STI HIV Program Manager of Cook County Department of Public Health. I've been in this field for 25 years. I got my start in public health as an HIV case manager. I worked very closely with AIDS Foundation of Chicago. In a nutshell, in my department, we provide case investigation to the residents of most of suburban Cook County. And it's not just case investigation because many of my team have experience, as I do, of being a case manager. So we sort of go outside of case investigation a little bit. When there needs to be referrals, we reach out to our colleagues from all over the state and also all over city of Chicago. So thank you for having me. I really appreciate being here.
And thank you. Thank you to all of you. Thank you so much. The work you're doing is life changing, it's critical, and it's necessary. So we appreciate each of you. Let's dive into the discussion. I'm going to start off by opening up questions to the group, but please, as you feel, if you're an expert in this, just go right ahead and you'll be able to answer the question as well. First question, Dr. Merson, what are the most significant barriers patients currently face in accessing consistent, high quality HIV primary care? And what are some of the ways we at CORE and beyond can actively support patients and deconstruct these barriers?
Okay. Thank you, Alice. That's a great question. And I always started with an imaginary situation. Imagine you never heard about HIV. You imagine you've never been sick. Imagine you live in a poor community and your parents are have some mental health or substance use issues. What do you know, right? What do you think? Would you ever be interested in doing HIV testing? Have you ever heard about HIV at all? Would you think you have a need to see a doctor? And at the end, you don't really trust doctors, right? Because things have been so confusing. So I think a lot of people don't really understand the complexity or the simplicity of it. So it's just taking a pill, it's just coming to the doctor or what it is. So I think there are structural issues for like, there are barriers. So it's housing, it's insurance, it's cost of health, it's access to health, but it's also stigma, it's lack of education, and is marginalization of some populations that they really don't know they have access to all of this. We are here. We can provide treatment, we can provide testing, we can provide prevention, but many times nobody knows we are here. So we kind of feel we're in a bubble. So we need to burst that bubble and we need to be accessible to all of them. We need to be there in the community and be heard and make the community be part of us and as part of the community. I think that will break a lot of barriers. And that's what happened in many countries, in many other communities where HIV is getting to zero. No matter how poor or rich the community is knowing that we are here and have the means to provide good primary care, provide HIV treatment and prevention, and we do have the means. So we need to get the word out and work with the barriers for housing, the barriers for mental health, barriers for substance use, barriers for stigma to prevent of that from happening.
Thank you. Thank you so much. And that is so well said. And many times, as we all know, it's like when we feel better, we don't go to the doctor. We don't. But prevention is everything. So thank you for sharing that and talking about busting that bubble, getting out there, being in the community and supporting each other. So let's shift gears a little bit. Let's bring in Toby from the health department to talk about community outreach and data driven strategies. Can you talk to us about what the Chicago Department of Public Health is doing in the field and what the numbers are telling us?
I can tell you about the Cook County Department of Public Health. Chicago Health Department is not our jurisdiction.
Oh, sorry. Thank
No, no,
you.
no, that's okay. It happens all the time. So as far as the data, at the moment we are in the process of working with IDPH to go over our cases of people who have left suburban Cook County. I have some notes, so I have to look at my notes a little bit. So we have a quality assurance project. And when we're done with that project, we will take that information so that we can see where we're needed the most. For example, in the past, we've used zip codes of where we saw the highest number of cases. And again, also using our experiences and resources from case management to go out and do outreach with our residents of suburban Cook County. And also, again, for the things that we are unable to provide, we reach out to our partners in the field that can provide services for us, such as the doctor pointed out, there's substance use, there's housing. I know of those barriers because of my experience in case management. So we work together as a team, not just with our patients, but also with the other partners that can provide assistance.
Awesome. Thank you so much. The next question is for everyone. PrEP has been a huge game changer in the fight against HIV and AIDS. Let's talk about the impact it has on prevention efforts in Chicago and in Cook County.
You want me to take that? Okay.
Absolutely.
Okay. So I just wanted to talk about that PrEP has been associated with a massive, substantial reduction in HIV transmission in community, both in real life. It has demonstrated a level, between 54 and 74% reduction in HIV new infections. So infections prevented or reduction of new infections in the community at least during 4 years of follow-up. For people that are really adherent to PrEP, the number goes up to 89%. And if you look at some states where PrEP has been available for longer and easily available with really an approach to reduce barriers to care, barriers to PrEP that has been demonstrated to be effective, these states have been noticeable for significant reduction of HIV transmission in the community. So that is really important is because it's a reduction in the infection for the individual, reduction in the infection for the communities, and the indirect benefit of decreasing viral load in the community. So it's less people living with HIV, less people not knowing they have HIV, and more people on prevention. So that's the best tool we have to get to zero, in addition to identifying and treating everybody that are living with HIV. So that is being demonstrated over and over again that PrEP is effective. So we just need to go for it.
All right.
Yeah, and if I could just thank you, Dr. Masson. I would love to add that we are thankfully in an era now where there's so many options related to PrEP, right? So we have not only the pill version, not only a generic version, but now we have injectable version. This is, a game changer. And we're seeing more and more people taking it, not only in Illinois, but across the country. Unfortunately, though, there's still great racial inequities related to uptake, right? So out of all the people who could benefit from taking PrEP, only a small percentage of them are taking it. And there are many reasons for that. I think it has to do with access and stigma, maybe awareness. So we still have a lot to do as it relates to PrEP uptake in Chicago and in the state, if not across the country.
I agree with that. It's being reported that among the population that is more affected by the HIV epidemic, the African Americans, Black population, the uptake of PrEP is about 7.9%. If you go to the white population, that number goes up to 60.9% of PrEP uptake. So there's a huge difference. This gap needs to be closed and has a lot to do with stigma and mistrust in the system, in addition to all the barriers we talked about. So that's very important, what you pointed out.
All right. Well, while we are with, thank you, Dr. Merson, for adding on to that discussion about PrEP and prevention and how those efforts have increased. We've even seen a lot of uptake here at the Core Center. So we appreciate that. While we're waiting for Simone to come back on, look like we may have lost her for a second. So I'm going to move on. Dr. Rousseau, just continue with the theme of support, and as we talk about supporting each other in the community and the support that the AIDS Foundation is also able to provide for our patients. Aside from medications, what are some other areas of support that CORE prioritizes to assure that persons living with HIV maintain viral suppression?
Okay, so that is very important that we work as a team, a multidisciplinary team, to guarantee that people have the support they need to maintain viral suppression or to be adherent to PrEP. Whatever they need, we need to work together to provide it. Is being in mental health, substance use treatment that we offer here at the Core Center, as well as case management, as Toby was talking about, that we work with together, even with our AIDS Foundation, to provide housing, transportation, and food. things like that. So we are here to provide peer support, to provide a place for people to come as the medical home and to address what their needs every single day. So in addition to that, we are able to provide comprehensive primary care, which I like to call complex primary care, which is not only treating the hypertension and diabetes and giving some pill for PrEP, but it's also taking everything in one place. So we address all the issues that the patients may have in one visit, and we also have specialties on site. So we have cardiology. We know a number of specialties as well as women's health and pediatrics, STI screening. So it's all in one place. So we're able to address the medical needs and we're able to address the mental health and social needs in one place. That's a wraparound system. And I believe that's the best way to deal with that. But in addition to that, we also in the community, we need to be out there testing and educating people. So that's we have to offer, and we're working to get better on that.
Thank you. And Simone, we were talking on the theme of support, and we know that the AIDS Foundation, though, the indispensable role of the AIDS Foundation in prevention and advocacy and community support across Illinois. Can you talk to us about some of those things and services that the AIDS Foundation provides to patients and to be able to link people to other resources in the community as well?
Absolutely, and how lovely again to be in on this panel with these other experts, and to have Toby, who's not only doing her great work with surveillance and at the Cook County Department of Public Health, but also comes with her massive case management experience. I think we've hit on the value of case management. All entities here are very familiar with the value it brings. And that's something I think in Chicagoland that we have a very strong network. And there's so many different services that folks need and they access on a daily basis, thanks in no small part to our experts who are our case managers. I do want to point out one newer program that we're very proud of. It's the HIV Resource Hub. The AIDS Foundation Chicago has been in partnership with the Center in Halstead for 5 years now. And this is a project that's funded by the City Health Department. And this is a place where what we call a no wrong door, where people can access either by calling or looking online or walking into the Center in Halstead. There are people standing by ready to help. If it's someone who's newly diagnosed and they want to know more about their options for treatment or for care, or if they are a PrEP user or they're interested in using PrEP, or have other support services that they want to learn about, the hub is a great place to go. I'll share this information. It can be shared elsewhere online, but folks can call the hub at 1-844-482-4040, or they can visit hivhub.org. And there are so many different ways to link into this really strong network we have in Chicago.
Can I just add a couple of things? Thank you, Simone. That's amazing. Maybe you can put it in the chat. But it's great. So it's good to have that option. I just want to add on that we offer here same day start for antiretroviral medication for people living with HIV. So if you're coming through our door and you do a rapid test and you're found to be HIV positive, you can start treatment on the same day. Also, we offer same-day PrEP, which really has been demonstrated that it increases adherence to PrEP. And we have access to injectable medication for both PrEP and for treatments, which may be an interesting option for some people. Maybe not everybody likes injection, but it is an option. So what I'm saying is that we have options and we can treat it right away for both PrEP and prevention. So we have our doors open every single day, Monday to Friday, and we can treat, start the same day, we can prevent, start the same day. And we also work with the syndemic approach where we treat hepatitis B, hepatitis C, and syphilis, as well as other STIs. Right? So we have the resources to do so. Thanks to Ryan White, thanks to CCH, and to everybody that works with the soul and the heart here every day.
Absolutely. Thank you, Dr. Brisson. We also want to thank the AIDS Foundation of Chicago for also providing us with resources to be able to connect our patients to housing and case management as well. So, Toby, how does CCDPH leverage its data to identify hotspots or community of highest need? And what strategies are proving most effective for conducting culturally competent outreach in those areas?
As I mentioned before about our quality assurance, once we complete the quality assurance project, that's when we'll use that information where we can identify opportunities for prevention. Um, but as far as in addition to that, I wrote some notes here. We also want to look at clusters, the hotspots, where to focus our um, prevention information. Um, and I also wanted to point out, I had a point I wanted to make about stigma, and I've lost my train of thought. So could you give me the last part of your question again?
Sure. Um, it was basically
About cultural
what are the
competency?
strategies, strategies that are effective for conducting culturally competent outreach in those hotspots?
Okay, so um, in my personal experience working at Cook County Health Department, I have had to provide training across the state about working with certain populations, such as Black and Latino, MSM, and the transgender population. So, one takeaway I have as far as being culturally competent, we need to just listen to our patients and pay close attention to what they need. If you have any type of bias, and we all have a little bit of bias, and I feel that as public health workers, as doctors, as anyone working in this field, we have to acknowledge that we have bias, but our job is to listen to our patient, find out what they need, and figure out the best way to portray information in a way that they will take it. I hope I'm making sense by explaining that. But I have found when I used to work in clinic, if I had a young girl in front of me, or a gentleman that had a prison history, your approach is going to be different. Another thing that we need to do is make sure we increase our own knowledge and our own education. Because one of the young ladies that I spoke to in clinic, I'm sitting here, writing her paperwork for testing. I'm asking her about boyfriends, and I can see that her whole face fell, and I couldn't figure out why. And later, a nurse came to me before I was going to see the patient for one final time before she left clinic. The nurse mentioned this patient, and I said, yes, she had a really cool necklace on. It was like a rainbow, and it had all this. Well, unfortunately, me being, still relatively new in the field, I did not know what the rainbow meant. So when the young lady came back into my office because they see the epi at the end of clinic, I basically explained to her, I'm very sorry. I did not understand what the rainbow meant. So I know that the questions I asked you were not the right questions. And I apologize for that. And I'm going to make sure I find competence for myself. This was years before I was tasked with doing cultural competency training. But I will say the easiest answer to that question is that we as individuals working in this field, we have to find out what the patient needs and we have to find out the best way to reach them.
Absolutely. And similarly, just thinking about new markers and identifying just areas and the current statistics that follows with those numbers, are there any specific groups that you are targeting as a result?
Well, we don't have our results yet, but I will say that in my particular experience working here, one group that we have targeted has been the MSM population that are highly at risk. I would say that would probably be the top, but not only that, working with these cases more and more, we're seeing pregnant women that are impacted with HIV. So we're, trying to put things in place so we can work with that population as well.
Awesome. All right. Dr. Masone, did you want to comment on anything that Toby just offered?
Yeah, so I think I agree with all of that, that we need to be able to let people come to us with open mind, open heart, and let them tell us what they need, right? In anyways, we need to listen to the community. We need to listen to the individual. In clinic, we know I have, today I had in the same clinic a 20 years old and a 89 years old, one with no health problems, but with a lot of social and family issues, new migrant, and another one with many comorbidities that as 89 years old living with HIV may have. So there is a spectrum, and we need to be mindful of that. And I think it's important to, as much as we can, engage the community and the family to know, to provide knowledge, to provide access to knowledge to them. And I agree totally with Toby that we need to see what they are open to hear and what they want to ask us. Because sometimes they're just feeling like we imposing things, and then they're not ready. That's not what they want,
That
right?
was my mistake when I started. I often told patients what I felt they should do as opposed to me asking them what they needed. And it took some time, but I got there. I did want to make a comment about stigma a little bit. What we do at the county is, again, the educational piece. But one thing that I've done personally with patients is I emphasize to them, you have a chronic disease that's treatable. So you're going to treat this as though you would any other chronic disease, such as heart disease or diabetes. This is something that you're working on as part of your health. You're not some scourge on society. And that's what I was thinking when I had lost my train of thought before. So I apologize for that.
No, thank you, and thank you for sharing that, because I think that's needed. We talked about, debunking stigma. What do we do? How do we get out there or put ourselves out there so that we can engage more people? So I think that's important. So thank you so much for sharing. Simone, what does the phrase ending the HIV epidemic in Chicago or Illinois by 2030 mean? And what progress has been made towards this goal?
Yeah, thank you. I want to thank the stories that were just shared. I think that really gives life to folks, the lives that they're living, and the challenges, the real challenges that people are facing. But I'm happy to talk about ending the HIV epidemic and what that looks like in Chicago. So the reference there is from the Getting to Zero Illinois 2.0 plan, which many people were a part in developing. In the state of Illinois, we see a future in which there are no new HIV infections and there are no people living with HIV who are not in care. So in Illinois, we talk about a functional zero. And what that means in this state is that when we reach a point where there are fewer than 100 of new HIV cases every year, the HIV epidemic cannot sustain itself any longer. And that's what we're aiming for. That's like the North Star. And we get there through a number of pathways. It really boils down to getting more folks on PrEP and more folks who are living with HIV in treatment and virally suppressed. There are a number of ways to get there. I think we've already talked a lot about that, but it really comes down to being there for each other and making sure that all people living with HIV are diagnosed as early as possible and they're in care as soon as possible. And we reduce those barriers to care, including the stigma that Toby was just talking about.
Yeah, thank you. Thank you, Simone, so much for that.
Excuse me.
We talk about just moving forward, the era moving forward, and no new infections. And to get there, um, we really do need and appreciate the new treatments for HIV, like the long-acting antiretrovirals, the injectables, and notably for PrEP, and how PrEP has changed the HIV care for all of us. So, very good discussion. Thank you for that. So, here, this is our last question, and this is for the group. If someone is newly diagnosed, say today, what is the single most important thing they should do next, and where should they go? and it's for the group. Anyone can start off. We'll start with.
I'll pick it up and then I'll pass to let others. I would encourage any person who's finding out for the first time that they're living with HIV to call and find a case manager. And I'll give this number, but to call the AIDS Foundation Chicago to request case management services. That number is 312-690-8860, or to call the HIV Resource Hub. And again, we'll share that phone number, or hivhub.org. But I'll pass it on to Dr. Mason and Toby.
I'd like to make a comment on what I think the first thing that should be done for the patient. I feel that the patient should allow themselves to have their feelings at that moment. In my experience, sometimes they're not quite ready to make a phone call. They're not ready for me to give them the information they need to move on. If they need to scream or cry, or I've even had someone laugh when I gave them the result. But I think the very first thing, if you're giving them the result, let them have their feelings. Let them know that whatever they feel, it is completely okay. And then I would move on to the calling AFC or, provider.
Okay, so I think that's my turn. And I think, I have a different point of view here because I'm seeing people that are newly diagnosed every week or at least a few times a month. And I think the first, and I have the luxury to have them here, tested here, diagnosed here, or being sent to us already with the diagnosis. That many times they don't believe it. They don't believe it's true. So then we just have to talk to them, let them talk, let them feel their feelings. I totally agree with you, Toby, and fight the virus, not the person, right? So then we need to provide the resources they need to go through it, like any other disease, any chronic disease that it may be diagnosed with. They don't want to hear about it or not ready for it. They don't know what it is, right? So it's just being able to give the support to the person and offer the treatment for the virus. So I think that's and knowing what you're doing, I think that's helpful to address providers' gaps, to make knowledge gaps, to make sure everybody knows what they are able to provide to the person. So we work with a team that they know how to treat people, right? So I think that's the most important thing. We know medically that treating as soon as possible is very important. Is one of the most important things. Keeping people undetectable is very important because they keep somebody healthy, productive throughout their lives, and also decreasing transmission in the community. So you have to provide this kind of information and be there for them. I agree with you, Toby. That's the most important thing. If they don't want to treat the HIV today, that's going to be tomorrow, that's going to be next week, but we need to be on them to make sure they understand.
That's good. I like that. Thank you. Fight the virus, not the person, but do stay connected. Connect to us. Thank you. And thank you so much, Simone and Dr. Masson and Toby, for sharing your experiences and your insight. Your commitment is what drives this movement forward. So we thank you and appreciate you for that. We'll be linking two resources in the chat from all of our partners, including the Core Center, the Cook County Department of Public Health, and the AIDS Foundation of Chicago. It will be listed in the chat. And thank you to everyone for watching and being a part of this conversation. Whether you're living with HIV and AIDS or supporting someone who has been diagnosed or just looking for information, it's important that you are educated and that you know that there is resources out there. At Cook County Health, we have many resources and ways of connecting you to the support that you need, regardless of insurance or the ability to pay. So visit cookcountyhealth.org/core for more information on testing, PrEP, and HIV care. And again, thank you to everyone and have a great World AIDS Day. Thank you.
Thank you.